Did you know that the key to managing your arthritis pain, a stuffy nose, or even a good night's sleep might be hiding in your medicine cabinet? But what if I told you that same key could also be unlocking a silent door to a heart attack or stroke? This is a truth that is not often discussed. Because once you turn 60, your body's relationship with medication changes. Your liver, your kidneys, they no longer work with the same efficiency they did at 30. And this creates a new landscape of risk that many are unaware of. Consider the tragic irony. The very pill that gives you the freedom to walk without pain could also be the one that sets the stage for a life-altering event. In a few moments, I am even going to discuss how a medication prescribed to protect your heart could, in some cases, do the exact opposite. I am not telling you to stop your prescribed medication. I am here to empower you with knowledge. There are at least 7 common medications, many available without a prescription, that may significantly raise your risk. And chances are, you are using one or more of them. In this video, we will pull back the curtain on these drugs. You will learn what they are, how they pose a threat, and most importantly, how to have a more informed conversation with your doctor. Let us begin with medication number 7, NSAIDs. You likely know them by names like Advil, or Motrin. For millions, they are the go-to solution for aches and pains. But they come with a hidden cost, especially for seniors. These drugs signal your kidneys to hold on to salt and water. Think of your circulatory system not just as pipes, but as a delicate ecosystem. Suddenly adding more fluid volume is like causing a flood, dramatically increasing the pressure against the banks, which are your artery walls. At the same time, NSAIDs can make your blood platelets, the tiny cells responsible for clotting, become stickier. As we age, our arteries naturally lose some of their smooth, non-stick coating. When you combine higher pressure with stickier platelets in less flexible vessels, you create the perfect conditions for a dangerous clot to form. Let us move on to medication number 6, the sweet trap. This refers to a class of drugs for type 2 diabetes called thiazolidinediones, or TZDs, such as pioglitazone. They are powerful allies in controlling blood sugar, but they have a side effect that becomes more dangerous with age: fluid retention. Imagine your heart as a diligent, lifelong pump that has been working tirelessly for over 60 years. It is still strong, but it is not brand new. Now imagine asking that pump to move a thicker, heavier fluid day after day. That is the extra burden that fluid retention places on it. Over time, this can overwhelm the heart, leading to or worsening congestive heart failure. You might notice this as unusual shortness of breath, swollen ankles, or a profound fatigue that sleep cannot fix. It is easy to dismiss this as just getting older, but it could be a signal from your medication. Next, we will uncover the truth about medication number 5, prescription sleep aids. The peace of a good night's rest is something many seniors long for. A sleeping pill can feel like a welcome shortcut, but large-scale studies have revealed a concerning link between their frequent use and a higher risk of cardiovascular events. One reason is that these medications can suppress your natural breathing rhythm while you sleep, sometimes causing pauses in breathing, a condition similar to sleep apnea. This reduces oxygen levels and puts immense stress on the heart. Furthermore, they increase your risk of falls. A fall for a senior is never a small event. A broken hip can lead to surgery and prolonged immobility, which is itself a major risk factor for developing deep vein thrombosis, blood clots that can travel to the brain and cause a stroke. Medication number 4, tricyclic antidepressants. Depression is a real medical condition that deserves compassionate treatment. An older class of drugs, tricyclic antidepressants, are sometimes prescribed. However, they can interfere with your heart's electrical wiring. Think of your heart's rhythm as a finely tuned orchestra. These medications can disrupt the conductor, leading to an irregular beat or arrhythmia. For a heart that may have underlying issues, This disruption can be the trigger for a major cardiac event. Medication number 3, decongestants. When you are suffering from a cold, a decongestant with pseudoephedrine feels like a miracle. It works by shrinking the blood vessels in your nose. The problem is, it does not stop there. It shrinks blood vessels throughout your entire body. This is like squeezing all the garden hoses in your neighborhood at once. The pressure inside the system spikes. For a cardiovascular system that may already be dealing with high blood pressure, this sudden surge can be incredibly dangerous. Medication number 2, proton pump inhibitors, or PPIs. For the agony of acid reflux, medications like Prilosec and Nexium are lifesavers. They work by drastically reducing stomach acid. However, emerging research suggests a troubling link between long-term PPI use and heart attack risk. The theory involves a molecule called nitric oxide, your body's natural vessel relaxer. Nitric oxide keeps arteries flexible and prevents inflammation. PPIs may interfere with your body's ability to produce this vital compound. Over time, this can lead to stiffer, more damaged arteries, creating a fertile ground for plaques and clots. Medication number 1, calcium channel blockers. And now, we arrive at the most ironic and dangerous part of our discussion. This is a medication many of you take specifically to protect your heart. Calcium channel blockers like amlodipine are prescribed millions of times a year to lower blood pressure. They work by helping blood vessels relax. So what is the problem? It comes down to a crucial detail: how fast they work. Some short-acting versions can cause your blood pressure to drop too suddenly. Your body perceives this as an emergency and mounts a counterattack, flooding your system with adrenaline. This makes your heart beat faster and harder, demanding more oxygen at the precise moment it might not be available due to narrowed arteries. This rebound effect can trigger a heart attack. That is why modern guidelines strongly favor extended-release versions that work gradually over 24 hours. A small detail in formulation can mean the difference between safety and danger. The real threat is not any single pill. It is the interaction between a drug's mechanism and your body's unique biology as it ages. Understanding how they work is what empowers you to ask your doctor the right questions. Watch our next videos on the real causes of heart attack and stroke. Stay informed, stay safe, and stay in control.